My name is Dr. Glenn Kenneth Guzman and I am a fourth-year emergency medicine resident working at Eastern Visayas Medical Center.
Good evening, this is Dr. James Lodostria from the Emergency Medicine Department of EVMC.
Ako si Johanna Capito, contact tracer at LGU Borongan.
Hi, my name is Junar Lustre. I am working as a nurse in the DOH assigned in Borongan City, Eastern Samar.
Hi, I'm Jay Gaspar, a member of Ormoc City COVID-19 Task Force. I belong to the Ormoc Resident Recovery Team who receives LSI, ROFs, APORs, and close contacts. When this pandemic started last year, me and my team rented an apartment to keep our families away from the risk and exposures of this COVID-19.
I can remember it was around last year when the cases of COVID-19 was at an all-time high here in Region 8. And as a doctor working at the emergency room in Eastern Visayas Medical Center, we were one of the people who were with the highest risk in terms of exposure to COVID-19 suspects. And back then, I can remember na every time I went home, I was afraid that I would possibly infect my relatives because I have an aunt who is 88 years old and my mom who is 66 years old here living at home with me.
During the early days of the pandemic, I had to leave our house and look for my own apartment in order to protect my family, especially my parents, who are in their senior years and are also at high risk of contracting COVID due to their comorbidities. There were even instances where I literally experienced being discriminated when one of the landlords I spoke with rejected me instantly after knowing that I was a frontliner. It was sad, but I have to move on with that.
I am one of the healthcare workers who were provided with an accommodation in Madison Park Hotel as our quarantine facility after our hospital duties.
Hanmaray pa OCD accommodation nga diha Borongan. Makuri naman adlaw ng biyahe. Tungod nga harayo itakong balay nga di opisina. Tapos danay maray pa tricycle nga makuri ang tricycle ng danay maray na biyahe. So makuri makasakay danay malilate. Tas danay higabi kay makakauli dahil nakadamat ang guilty trace. Ang accommodation nga ginhatag ang OCD daka ugod nga bulig hamon ni mga frontliners kay unang-una ang transportasyon. Diri ko na kinahanglan inuli-uli nga tuhit akon balay nga dinala akon diri nga tulak diri sa accommodation. Tapos ani kaduha pagkaon dako liwat nga bulig nakapag-iban han budget ba namon. Kay upod man inihiyahan gin provide. Tapos ikatulo pa hindi na naging mas komportable kay ipinahirayo ko na akong pamilyahan. Kadelikaduhan ba dara kay tam trabaho agsud kami nga gawas exposed good man kami. So asya ito nga maupay gud ako nga buligan accommodation hamon.
Fortunately, the Office of the Civil Defense provided us with a convenient and a comfortable accommodation, hotel accommodation, together with other teams, as well as food provisions.
This accommodation provided by the OCD helped us healthcare workers to have a peace of mind because at least we have a place to go to after our duties and not worry about infecting other people, especially our loved ones.
So when the Office of the Civil Defense provided us accommodations and food, I was very happy because I know this program will definitely lighten and ease the burden emotionally as well as financially for us frontliners, knowing that after every duties, after every late night works, we have comfortable beds and food waiting for us. And that really served the purpose of this program.
After learning about the accommodation provided by OCD with regards to healthcare workers amidst the pandemic, and being one of the people who was able to benefit from the said accommodation, I could say that it really helped me lessen my worries with regards to possibly infecting my relatives here at home, especially them being elderly and with comorbids. It really helped a lot with my day-to-day work at the hospital.
If by any chance that our request be granted, would love to continue availing this program in the future so that we can continue fighting this battle and eventually winning this war, knowing that we have this kind of amazing program backing us up.
Malilipay nga dapat ako salamat kung tatagan liwat utro ako higayon para yung hininga accommodation. Gidada ko yung bulig hamon, especially mga healthcare workers and frontliners, para hindi ko upay atong bungko.
So hopefully, in the future, the Office of the Civil Defense, especially in the Region 8, will still provide for our frontliners battling this COVID-19. Thank you so much.
If OCD once again decides to open up a program similar to what they've done last year to help healthcare workers such as myself, especially now amidst a pandemic, to help us find a place to stay, to self-isolate and quarantine, I would be very grateful to be able to avail of their help once again, especially knowing that I could at least reduce the risk of possibly infecting my relatives who are elderly at home. Thank you very much.
And I am not just speaking for myself, I'm speaking for all of my co-residents in emergency department of EVMC, and we would like to avail this kind of offer if in the future we are given a chance. Thank you.